Okay, so I want to start out with just a PSA that I made back in February to sort of set the tone for my concerns about dietary supplements. Hi, I'm Dr. Bob Speth. I'm a professor of pharmacology at the Nova Southeastern University College of Pharmacy. I'm here today to talk to you about counterfeit sexual enhancer drugs. For most of us, looking deep into our lover's eyes is all it takes for lovemaking to ensue. But for some of us, our body doesn't respond as it should, and that moment is lost. Fortunately, there are prescription drugs that can solve the problem of erectile dysfunction. Sildenafil, known best by its brand name Viagra, was the first, but tadalafil, Cialis, and vardenafil, Levitra, work similarly. Because they work so well, there are many copycats who infringe upon the name Viagra, peddling sexual enhancer products with false and misleading claims of similar actions, or, in some cases, secretly adulterating their product with Viagra-like drugs. So, my message today is to alert you to the public health threat posed by counterfeit and fake drugs marketed with names like vegetable Viagra, herbal Viagra, or products sold with similar deceptive names. There are three main problems with these products. One, they are often secretly adulterated with unknown amounts of the active ingredients of Viagra or similar substances that have not been approved for use as drugs by the Food and Drug Administration. In recent years, the FDA has found more than 300 sexual enhancer products that were adulterated with the active ingredients of Viagra-like drugs, and in one case, a sexual enhancer pill was found to contain 31 times the amount of tadalafil found in one Cialis pill. Viagra, Cialis, and Levitra are prescription drugs and should only be taken in consultation with a physician or a certified health professional. They can interact with other drugs, potentially causing death, and have dangerous side effects, such as the erection lasting longer than 4 hours. 2, these products have little or no quality control or safety testing. Contamination of these products with heavy metals such as lead, allergens, and substances not approved for human consumption can pose serious health threats to their consumers. While the FDA monitors these products for health threats, they simply cannot keep up with the plethora of such drug products. So it is like the FDA is playing whack-a-mole. Every time the FDA exposes a fraudulent product, another one pops up. And 3, these products are frequently marketed illegally, without the approval of a registered pharmacist filling legitimate prescriptions. And they infringe upon trademarks. So the question potential consumers of these products should be asking themselves is, should I trust my future health and well-being to a product being sold to me by criminals? I encourage anyone considering using one of these alternative sexual enhancer products to Google FDA sexual enhancement pills to see how dangerous these products really are. And yes, okay. So I have some disclosures. I don't have any interest in financial interest that would compromise the objectivity of this presentation. However, I am serving as a pro bono expert witness for a state agency that is challenging the claims made by Quincy Bioscience, who is the maker of Prevagen. You may have seen the advertisements for the jellyfish protein that's supposed to improve your memory. I have also contracted as an expert witness for 2 different law firms who are pursuing class action lawsuits against Quincy Bioscience for making false claims for Prevagen. So I'm not talking about Prevagen in this talk, so that there's no conflict there. Of note, the Federal Trade Commission, as well as the New York State Attorney General's Office, has charged Quincy Bioscience with making false and unsubstantiated claims for Prevagen's ability to improve memory and to provide cognitive benefits. Okay, secondary disclosure. Okay, I actually do take some dietary supplements. Okay, this is the balancing part of the presentation. So these are my list of supplements. I take a daily multivitamin. I take CoQ10, I also take melatonin, and a baby aspirin. But the reason I'm taking them is because there's science-based evidence for taking these supplements. Okay, and before I go any further, I do want to encourage you to ask questions at any time, raise your hand. I really love it when the presentations are interactive and I can have a back and forth with students during the presentation. So please feel more than welcome to raise your hand or ask a question at any point in the presentation. Okay, so the coenzyme Q, I'm taking a statin for high cholesterol, and statins are known to interfere with the synthesis of coenzyme Q10, which is a very important mitochondrial enzyme. So, to make up for the possible loss of coenzyme Q10, I take a supplement of coenzyme Q10. Melatonin actually has two benefits. Okay, melatonin is actually an excellent antioxidant, and it has a very good ability to get to the mitochondria where you need it the most. Okay, in addition, you may have heard that melatonin is the body's circadian rhythm regulator. So during the night, you get stimulation of your pineal gland. And I think I have a nice little diagram here. So you have light coming into the suprachiasmatic nucleus, which goes to the paraventricular nucleus. By the way, I'm a neuroscientist as well, which then turns on the sympathetic nervous system, and that goes down to the spinal cord and activates the superior cervical ganglion, which then projects to the pineal gland and says, make melatonin. Okay, so melatonin is very important for the circadian rhythm, and being a professor and somebody who has to work late often to get my lectures ready, I have the worst circadian rhythm of anybody in the world, so I do depend on melatonin to help me get my cycle somewhat back to normal. Okay, so the baby aspirin, aspirin is an anticoagulant. It's an irreversible inhibitor of cyclooxygenase, and it decreases the likelihood that platelets are going to aggregate and form a clot. Yes?
Why are you taking adult aspirin? Are you taking like just 4 doses of baby aspirin instead? Or?
Okay, the 81 milligrams of aspirin is more than enough to inhibit the cyclooxygenases in your platelets. Okay, indeed, they say only once every 2 days. But I have trouble, remember, was it yesterday or today that so I just take it every day, routinely. So anyway, it's a very good antiplatelet drug, so it decreases your likelihood of getting a stroke. But in addition, there's a reduced risk of colon cancer if you're on daily aspirin. So this is 2 reasons why I take the aspirin. And then the vitamins, okay, this is a little bit controversial, okay? But the fact is, I'm getting up there in years, and as you get older, you're not as capable of absorbing B vitamins from your diet, even if you have a very good diet. So just to be safe, I'm taking a daily vitamin. So it's still a very controversial topic. There's some people who say the lack of evidence, but the lack of evidence doesn't mean it doesn't work. So it's still an open-end question. This article from WebMD says don't waste your money on vitamins, but then they have the little caveat, many older adults, vitamin B12, you may not be getting enough. So I'm taking the vitamins for insurance. And I get my daily vitamins from Costco, and I calculated it as 3 cents a day. So I think I'm okay, not throwing all that much money away taking the daily multivitamin. Okay, so some background on the dietary supplement industry. It is huge. This goes back to 2017 when there was $36.1 billion just in the United States from sales of dietary supplements. So this is a monstrous business. Okay, and this is just looking at the distribution of people who are taking them, people who are giving them to their infants, children, adults obviously are the biggest slice of the pie, pregnant women, and indeed, things like vitamin B6 or, folic acid. I think that's vitamin B5 is very important for preventing birth defects. And then we have the elderly, and you can see we're creeping up there in our proportion of dietary supplements. Okay, and with all businesses, there's a newsletter you can subscribe to keep up to date with all the new trends in dietary supplement industry. Okay, and this is just something I got from the New York Times a few years back, talking about all the supplements that are being sold and all the different companies that are selling them. And basically, the New York State Attorney General's office said, you know what, maybe some of these products that you're selling aren't really what they are claiming to be. And again, this is where I come back to that video I was talking about. The quality control on some of these products is disastrous. I mean, they've done some analyses of some of these dietary supplements, and they range from 0 content of what's on the label to, in that Cialis example, 31 times as much of the Levitra, or I'm sorry, blanking on the generic name, of the active ingredient in Cialis in this dietary supplement that really wasn't a dietary supplement, because in order to be a dietary supplement, it has to be a naturally occurring product. It can't be a drug that's synthesized, okay? And the, I think it's tadalafil in Cialis, is a synthetic chemical. So it's not a dietary supplement. So that's, again, one of the frauds being perpetrated by many of the bad actors in the dietary supplement industry. So the Attorney General's office ordered Walmart to pull, well, GNC, Target, Walgreens, and Walmart to pull a number of store brand products off of their shelves because they were mislabeled and didn't have the ingredients in them that they claimed to have. So the tagline here that I love is, Americans are ignoring the science and spending billions on dietary supplements. What's unsaid here is dietary supplements that are worthless and potentially can do harm. And I do have an example of, I have several examples of harms that can occur. Okay, so we have 5 different classes of likely fraudulent dietary supplements. I'm not sure which one, it's hard to figure out which one is the worst offender, but weight loss supplements mostly are worthless. Those that are effective are dangerous. And the example here is ephedra. Ephedra is actually a very potent sympathomimetic drug. It will cause you to lose weight. But what happened is a lot of people taking ephedra also had adverse cardiovascular events. Some people had strokes. Okay, so actually ephedrine is not that dangerous. The problem was people would say, oh, I'm going to buy this ephedra product to help me lose weight. It says take 1 per day. You know what? I'll bet if I take 2 per day, I can lose weight twice as fast. And that was one of the major problems with ephedra, is that it wasn't so much that it was an unsafe drug, it was the fact that people were using it in an unsafe manner. Yes?
That drug that you're talking about the same as like a carb blocker? Like a carbohydrate blocker?
No, it's different. It's a sympathomimetic.
Okay.
It turns on your fight or flight reaction. Okay, so it gets your heartbeat beating faster, it constricts your blood vessels, raises your blood pressure, and if you do that too much, you can have worse cardiovascular effects. You know, it's increasing the wear and tear on your cardiovascular system and your heart. Okay, so the sexual enhancers, I think I covered that fairly well. The energy enhancers, there's a whole lot of stuff on the market. Some of it will work. Some of the protein shakes probably have some benefit. You want to be careful. You don't want to overload your diet with protein to the exclusion of everything else, or you're going to destroy your kidneys. Okay? The cognitive enhancers, I have been after the cognitive enhancers long before I ever started paying attention to Prevagen. There are so many on the market, and virtually all of them are fraudulent. However, I will give a shout out to fish oil. Okay, fish oil is high in omega-3 fatty acids, and it probably is good. And it just kills me that I can remember when I was like 8 years old, and my dad would say, "You should eat that fish, it's good brain food." Dang, he was right. You know, 65 years ago. So anyway, yeah, most of the cognitive enhancers that are being advertised are garbage. And then we have the joint pain release, the glucosamine, and so on. They're probably of no value whatsoever. And you're probably better off with just NSAIDs, non-steroidal anti-inflammatories, acetamin-type drugs for real serious pain relief. So, and then I was going to put the video in here, but then I started with it. Okay, so I couldn't resist putting this one in. Okay, we all know Steve Jobs, Mr. Apple. You know, Apple is now the most valuable company in the world. It's worth more than $1 trillion. And it was started in the garage by Steve Jobs and one of his buddies. Okay, so this guy was an absolute genius, okay? And yet, he was diagnosed with pancreatic cancer at an incredibly early stage. And in fact, it was an accidental diagnosis because he had some other kind of a problem, and they did an MRI on him. And they said, "Oh my goodness, you've got a couple of spots in your pancreas. You know, it looks like it's a very innocuous cancer, but we really should do surgery and get rid of that cancer." And he says, "Nah, I don't think so. I'm going to consult with a vegan, go on a vegan diet, consult an acupuncturist, and a palm reader type person, and rely on herbal remedies." Okay, so he did that for 9 months. And then he got another scan, and the cancer was continuing to grow and it was getting worse. So then he finally got the surgery. Well, unfortunately, by that time it has metastasized, and that is ultimately what killed him, despite having all the money in the world that he could devote for anti-cancer treatments. He got a liver transplant, they genotyped his cancer, everything possible, anything that money could buy. And still, he had let the cancer go too far because he pursued alternate medicine. And I'm going to say it many times, there is no such thing as alternate medicine. There is real medicine, and there's fake medicine, okay? And alternate medicine is fake medicine. It's kind of like at the beginning of the Trump administration when Kellyanne Conway came out and was caught in a lie. She said, "Oh, well, we have alternative facts." Well, I analogize alternative facts to alternative medicine. It is not medicine. And unfortunately, it cost Steve Jobs his life. Okay, so I have been very interested in dietary supplements since like 1977. when my mother-in-law got breast cancer. And my mother-in-law was brought up on a farm. They were very poor. After 3rd grade, she had to go out and work in the fields, so she wasn't very well educated. And when she got breast cancer, she happened to mention it to somebody at her church. And the person at her church said, "Oh, well, you should go to Mexico and get Laetrile." Okay, well, Laetrile basically is a precursor of cyanide. So yes, cyanide does kill cancer cells, no doubt about it. However, it will also kill all your other cells. Okay, so I tried as hard as I could to convince her that this was the wrong choice and that she needed to get traditional therapy, probably a mastectomy, and she was afraid of the doctors, and she put the word of her colleague at church above that of the medical profession. So she went to Mexico, got her Laetrile. They did some radiation and burned the hell out of her breast. And 2 years later, she was dead after being bedridden for 6 months. So ever since then, I have really felt like I had a mission in life to present to any audience that's willing to listen to me how dangerous it is to pursue alternative medicine. And many, many, many of the dietary supplements out there are falling into this realm of alternative medicine. So the National Institutes of Health has an Office of Dietary Supplements, which is actually doing a pretty good job of trying to monitor dietary supplements and find out, sift out the good from the bad. So they have an annual seminar or symposium every year, and I went to it one year. And it was very eye-opening because there are some really good actors out there. There are really some good companies out there that are making legitimate, helpful dietary supplements. Unfortunately, there's also a lot of bad actors out there. And unfortunately, in my personal opinion, I think there's more bad actors out there than there are good actors, which is why, I talk about the dangers of dietary supplements. Okay, so you may wonder when you buy a dietary supplement, invariably they'll have this disclaimer. This statement has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. Okay, so in 1994, there was a compromise legislation put forth, and I think I have more on it later. But basically, the dietary supplements weren't really drugs, and they weren't really food. And there was a lot of ambiguity, and the government was like, well, how do we handle this? So what they did was this guy from Utah, Orrin Hatch, a senator, very powerful senator, he had been a senator forever, was representing the dietary supplement makers, which are extremely highly concentrated in the state of Utah. So he was kind of on behalf of the dietary supplement makers in Utah, pushed legislation through called the Dietary Supplement Health Education Act, or DSHEA, in 1994. And it was signed by President Clinton, the great compromiser. And we now have DSHEA, which personally I think is a get out of jail free card for the dietary supplement makers. Because as long as they put that disclaimer on there, they can put any kind of claims, or they can give their product any kind of a name that suggests to a person who looks at it, oh, well, this must be a brain supplement. Okay, this is going to help my memory. And it's basically just the name. And if you read the required disclaimer, it will say, not intended to diagnose, treat, cure, or prevent any disease. Yes?
Wouldn't the Better Business Bureau, is the BBB crack down on this?
Huh?
Wouldn't the BBB, like the Better Business Bureau?
Better Business Bureau doesn't have a whole lot of teeth. The Federal Trade Commission is the one that is the one with the teeth. and they do go after fraudulent products. But again, as I was saying in the video, it's like playing whack-a-mole. You know, every time you nail one, two more pop up over here. So the FDA is fighting a constant battle. And the FDA is so undermanned that unless the dietary supplement is killing people, they don't go after them. Okay, as long as people aren't dying, they're going to be allowed to exist because the FDA has their hands full going after the people that are selling fake Viagra, putting you know, an analog of Viagra into their herbal remedy that could potentially be killing people. So yeah, it's unfortunate, but that's what the situation is. So anyway, if you look at virtually any product that's being sold as a dietary supplement, if you look closely enough, you will find this disclaimer on the label. So that's what you should pay attention to. And the claims that are being made or based are the claims that are being inferred by the name of the product are very likely to be deceptive and misleading. Okay, so my topics and themes, you've already gotten a smattering of it. The concerns are efficacy. That means, does it do what it says it claims to do? Is it safe? Do they exert any type of quality control? There are some reputable manufacturers who do use reputable quality control measures where they know the exact amount of the active ingredient, the identity, and make sure that it's not contaminated or adulterated with dangerous products. One of the worst concerns about adulteration is heavy metal contamination. And I have a terrible, terrible example of a situation where someone was told to take a calcium pill. And basically the calcium pill killed her. Okay, so there are a lot of fraudulent products, ingredients not listed on the label that are deliberately adulterated. I've got an example of that. Again, some of them have prescription analogs. When I was at University of Mississippi, the people over at the Natural Products Center said, yeah, we did an analysis of natural Viagra, and guess what the active ingredient was? Viagra. So you know, the dangers are out there. They're all over the place. So we have agencies that are trying to regulate this, but again, there is just so many bad actors out there that they've got their hands full trying to keep up. So we've got the Office of Dietary Supplements, we've got the Food and Drug Administration, Federal Trade Commission. These are the guys with the teeth. They went after Palm Wonderful, pomegranate juice, which was claiming it could cure prostate cancer. The FDA said, we don't think that pomegranate juice is going to cure prostate cancer. And they went to war with them, actually. They ended up having to sue them in federal court, where the Palm Wonderful people backed down. And now it's just, they're using some generic terms to say how healthy it is to drink pomegranate juice. Okay, so again, the dietary supplements are in this never land. They're not foods and they're not drugs. Okay, and they've actually tried to take this advantage of this. In my opinion, a lot of these dietary supplements are drugs. But according to the FDA, it's not a drug unless the FDA has tested it and approved it and said it has efficacy. So now the dietary supplement people can say, oh, not a drug. And according to the FDA standards, it's not a drug. But in reality, it has the same effects or similar effects as many drugs have on the body. So again, this is kind of a never land, and it's very difficult to define your terms. So basically, a dietary supplement has to be a natural product. It can't be synthesized. Okay? And so it could be an herb, a botanical extract, an amino acid, so on and so forth. Okay. So vitamins are generally cofactors that are needed for normal physiological processes. Minerals or inorganics, calcium, potassium, sodium, manganese, magnesium, et cetera, that again have functionality in physiological processes. And then we have drugs. And again, as I mentioned, unless it's approved by the FDA, it can't be called a drug. So again, they're playing both ends of the middle, against the middle, and being able to advertise, well, it's not a drug, so you don't have to worry. But you'll find that if you go to the doctor, invariably now when you fill out that form, what drugs are you taking? There's also another line, what dietary supplements are you taking? Because they do have the potential to interact with drugs, and I've got a really super example on that. Okay, so another name that you see is nutraceutical. Okay, this is a made-up name to make it seem like, oh, it's a pharmaceutical product, but it's a nutraceutical. So it's again a deceptive terminology to make you think that this product may have some therapeutic application. An herbal is just usually a concentrate or a dried extract of a plant that has some potential for efficacy. And indeed, you know, a lot of the drugs we have today were originally derived from plants. Aspirin comes from willow bark. We have curare from the curare plant. The list goes on and on and on. So plant compounds are the basis for many, many drugs that we use today. Okay, so a botanical, that's sort of a very synonymous name with an herbal. And a natural product, again, it's naturally occurring, it's harvested, it's not synthesized, okay? So, and again, here's my little caveat about alternative medicine. And for a while there was actually an NIH branch called Complementary and Alternative Medicines. And I had a cow about it because, again, as I said, there is no such thing as alternative medicine. And fortunately, clearer heads prevailed, and it is now the complementary and integrative health institution, okay, which I'm a firm believer in integrative health. And hopefully I'll have a chance to get to one of my wonder of drugs that is in actuality integrative health. Okay, so this was an editorial by the editor of New England Journal of Medicine back in 1998, basically saying what I just said. There is no alternative medicine. There is only one medicine, and that's science-based medicine. Okay, so again, this is integrative medicine. This is what I really think is a wonderful alternative, or basically a complement to traditional pharmacotherapy, okay? So things like acupuncture, meditation, exercise, you know, having a healthy diet, these are all integrative health approaches that can complement pharmaceutical or pharmacological approaches to curing diseases and maintaining your health. Okay, so homeopathic medicine. This is another one of my pet peeves. I think homeopathic medicine is such a fraud, and yet it is been around for, well, since 1700s. And basically the idea is that if something is making you sick, you give somebody something that's making them sick to kind of build up an immunity or a tolerance to it. Okay, there's a little tiny bit of truth in that, but it's like an ounce of truth and a ton of untruths. So on a relative basis, the adverse considerations for homeopathic medicine far outweigh the benefits. But the other thing is that they do these things called dilutions. So, you know, it's like 1 in 10, and then 1 in 10 of the 1 in 10, and then 1 in 10 of the 1 in 10, and 1 in 10, ad nauseum, to the point where they dilute it so much that there's not a single molecule of the original substance by the time they've diluted it 100 times. Okay? And, you know, people have called them on it, and they said, oh, it's the essence, the memory of the substance having been in that solution that is what is curative. Okay, as you can see, as a scientist, I am really super skeptical on this one. Okay, and here's an example of a product that is one of my favorites. It's called Nux vomica. Do we have anybody here who's specialized in botany and botanical terms? Do you know what a synonym for Nux vomica is? It's strychnine. Okay? And now, fortunately, this is 30x. And 30x is 1 nonillionth of the original constituent. So it's probably not going to hurt you. Other than it's going to hurt your pocketbook because you're paying for basically water. Okay, but some of the homeopathic medicine distributors didn't do their dilutions right. And what they ended up with is some teething tablets that ended up not diluting out the atropine. Another name for atropine is deadly nightshade. Okay, it's named after one of the daughters of Zeus and Themis, whose job was to cut the string of life. So the whole idea of atropine was this is a lethal substance and you can kill people with it. So this Highlands company was diluting out this atropine, the belladonna, and they didn't dilute it enough. And the babies that were getting this teething powder were having adverse effects from the atropine, which was in way too high a concentration. So this is another reason why I'm not really a big fan on homeopathic medicines, because you're trusting them to dilute it to the point where there's nothing there. And if they don't do their dilutions right, well then they pose a serious risk. Okay, so this is something that just came up on WebMD last month, and I copied down a few of their concerns, herbal supplements that you shouldn't try. This is number 1 on my list, St. John's wort. You may have heard that St. John's wort is really good for treating depression. And it's a natural product. It's not a drug. Okay? So this is a wonderful thing to take if you're depressed and you don't want to go to the doctor and tell the psychiatrist or the doctor that you're depressed. So you just go to the Walgreens or GNC or whatever and buy some St. John's wort. So there was a woman who had a kidney transplant and she got depressed. So she started taking St. John's wort. Well, guess what? St. John's wort increases the rate of metabolism of the cyclosporin that she was taking to suppress her immune system so she wouldn't reject the kidney. So guess what happened to her cyclosporin levels after she started taking St. John's wort? They fell below the therapeutic level, and at this point, she rejected her transplanted kidney. So this is one of the very serious dangers of dietary supplements, and this is why when you go to the doctor's office now, they ask you, what dietary supplements are you taking? Okay, so they actually had, I think, about 15 of them. I picked out some of the ones that are most popular, most well-known. I've got ephedra in here. Ginkgo biloba has been falsely claimed. There's a question? Yes?
Do you think St. John's wort works in general?
Yes.
Okay.
Yes, it does have some psychoactive properties. But you need to know that it's going to interfere with your hepatic metabolism of whatever drugs you're on. So you need to consult a doctor. Okay, and that's something I'm going to be harping on later on if I can keep up this pace. Okay, so ginkgo biloba has been touted for improving memory. There is no scientific basis whatsoever for efficacy of ginkgo biloba. Okay, so anyway, these are all things that are being promoted and probably without any legitimate scientific basis. Okay, and I can't not talk about cannabidiol oil, CBD oil. It's the latest craze. Okay, well, CBD oil is now officially a dietary supplement and being marketed with false claims. And I couldn't resist. The Sun Sentinel back in February was talking about a medical fraud of a 20th century snake oil called Munyon's pawpaw oil. And then on the same page, same front page of the paper, they talked about CBD oil is here. And I couldn't resist writing a letter, which they didn't publish. But it was very nice to see how you juxtaposed 20th century fraud with a 21st century fraud. So CBD oil does have some legitimate value. But basically CBD oil is being marketed, okay, what's your problem? Oh, well, CBD oil will fix that. What's your problem? Oh, CBD oil will fix that too. Okay, so it's being marketed with a lot of false. And just to show you how it's such a pop phenomenon, it's such a craze, Kim Kardashian recently hosted a CBD-themed baby shower. And apparently she is getting $500,000 every time she posts something advertising a product that she supposedly approves of. Okay, so Carl's Jr. has a CBD-infused burger in Colorado. And basically, the claims for CBD oil are light years ahead of the scientific evidence supporting its therapeutic efficacy. Okay, so now we can add CBD to the fraudulent dietary supplements. So, yeah, we have a major problem. And this is an example of how the CBD craze is being abused. And CBD oil does work for the treatment of Dravet's syndrome and Lennox-Gastaut epilepsy. You may have heard of the term Charlotte's Web strain of marijuana. The Charlotte's Web strain is very high in cannabidiol. So as a result, people are looking to use it because it does have a legitimate therapeutic value. And in fact, CBD oil has been approved by the Food and Drug Administration as a legitimate drug, even though the Drug Enforcement Agency still considers marijuana to be a Schedule I compound with no medicinal value. So go figure out that oxymoron. But anyway, so this woman had a child with epilepsy, and she decided that she would try CBD oil. So she was in Washington State and was concerned about the authenticity or the legitimacy of the supplier. So she bought the CBD oil online in Colorado and started giving it to her child. Child got worse, okay, ended up in the hospital. And as a result, the hospital got some of the CBD oil and tested it. And it turns out it was spiked with something very, very similar to K2 and spice, which are synthetic THC analogs. They were developed by Pfizer, but then Pfizer put them on the shelf because they decided they really didn't have a good therapeutic value. So this is an example of how a product is adulterated and it's being sold without regulation, without quality control, and it just did cause some harm to this child with epilepsy. So the other thing is, why do people keep buying supplements? And my personal opinion is that they're riding the wave of the placebo effect. Okay, and I said I was going to talk a little bit about the placebo effect. So I love this article from the New York Times. What if the placebo effect isn't a trick? Okay, and I love this name of this drug, inerdominofen, or placeborol is the proprietary name. Okay, so in fact, there is a group at Harvard University called the Program in Placebo Studies and Therapeutic Encounters. Okay, and they're studying the placebo effect. And this is just incredible how efficacious sugar pills really are. Okay, that's why whenever a drug company is trying to develop a drug and doing the testing, they're required to have a placebo control group, and it's required to be double-blind, meaning that the people who are getting the drug don't know that they're getting the drug or the sugar pill, and the physicians who are evaluating them also don't know whether the patient is getting the drug or the sugar pill, because invariably everybody gets better. Okay, and the question is, did the drug group get significantly better than the placebo group did? That's really the thing that's most important for verifying the efficacy of a new drug. So these guys are studying this, and they did a study that will just knock your socks off. They did a placebo-controlled study of pain medication. Okay, 2 groups, sugar pill and a pain medicine for mild pain. But the twist was that they told the people in the placebo group, you're getting the placebo drug. Okay, and then they analyzed the data at the end of the study. Guess which group got the best effect? The placebo group. That's how powerful the placebo effect is. Okay, so when I say that the dietary supplements are riding the wave of the placebo effect, it is so apparent. It is such a powerful influence. I jokingly say that the most powerful medicine ever invented by humankind is the placebo. Okay, so this is talking about their open label study. So they're actually getting out to do things like fMRI, functional magnetic resonance imaging, of the brains of people when they're on a placebo pill to see what kind of brain changes are occurring. Because they would like to use placebo effects in regular medicine because it's such a powerful effect. So I'm not going to spend too much time on this. I'm treading on thin ice here, saying that the placebo effect could also be associated with superstition and potentially even religious beliefs. I happen to be a believer in the power of religion to help people to survive. That's partly because I was raised as a Christian Scientist, which is a faith-healing religion, and I saw how Christian Science could help people. I still am of the opinion that they got the right answers for the wrong reasons, and it was more a case of mind over matter. But still, the power of religious beliefs, and in this case, the Nigerian hunters have their charms, which they feel is going to protect them, and does make them more efficient. Okay, and then third-party objective review sites on the internet. Don't trust them. They are not reliable. And this is a perfect example. They're calling Rimonabant a dietary supplement. Rimonabant is a drug that was synthesized by Sanofi, was on the market for a short period of time until they discovered it was causing severe psychiatric disorders in the people who were taking it, including suicidal ideations, so it was pulled off the market. But if you go down through here, the only problem is just don't give Rimonabant to children under 8 years old. there's no adverse side effects, according to this website. But if you really look at this website, well, this is just a description from Wikipedia about the adverse side effects of rimonabant. You can buy it on the internet, so buyer beware. But anyway, if you look at any of the terms and conditions on any of these websites that are advertising these dietary supplements, what you're going to discover is that they've got pages and pages and pages and pages and pages of terms and conditions, most of which are saying anything we write on here we're not responsible for. It may not be accurate, and you should not use this site without consulting a health professional or your doctor. Okay, so why would you even want to go to this website? But then you discover that all legal proceedings arising out of connection with this agreement shall be brought solely in Maharashtra, India. So basically you have no recourse against these guys for putting out false information. And this is something that pops up when you're looking at their website. This is another one of my concerns, celebrities telling you what to buy. We already saw the Kim Kardashian thing. And this is an article that I got, and I love this part. This guy is the author of the book, Is Gwyneth Paltrow Wrong About Everything? Gwyneth Paltrow has her little goop, which she actually, and this one, you know, just obviously she's knows her literature, Madame Ovary instead of Madame Bovary, and it's, you know, just herbs, adaptogens. I don't know what an adaptogen is, but it sounds really good. Phytonutrients to ease the complaints of menopause. And she actually stole the name from my favorite hand cleaner, okay? And these guys tried to sue, and the federal court said, well, she's selling garbage, and you're selling something that really works. So they couldn't sue her for taking their name of their product. Okay, and then we have Kim Kardashian and her flat tummy lollipops. And basically, what you really should be seeing is the dollar signs in her eyes. And this is more regulatory, why we have the Food and Drug Administration in the first place. I could go on for an hour about this. I'm just going to jump over that real quickly. And this is something that's actually being sold in the NSU pharmacy, which kind of bugs me. One of the components of this is bovine orchic extract. That's another word for bull testicles. That's being sold in the NSU pharmacy as a health product. And this is the real life Hollywood tragedy. Okay, this actress, Allison Hayes, was a B-movie actress. She was one of the Scream Queens. The movies she appeared in were like B-rated horror movies. And she was the damsel in distress. Well, in 1962, she had dysmenorrhea. So the doctor prescribed a calcium supplement. So in 1964, she developed some muscle weakness. So the doctor said, oh, we'll double the calcium supplement. So she did. By 1967, she lost the ability to walk and was losing her hair. Okay, by 1968, she was confined to a wheelchair, and she stopped taking the supplement. But in the meantime, she had been to 22 different doctors trying to get a diagnosis, and basically all the doctors were saying, you got something wrong up here. Okay, so she finally decided she was going to take matters into her own hands. She went to the University of Southern California Library and started researching her condition and discovered that her symptoms were identical to heavy metal poisoning. Okay, so she sent some hair supplements and hair samples in the supplement to a forensic toxicologist, and it came back with high concentrations of lead. So her calcium supplement was highly contaminated with lead. And it turns out, well, in 1976, she was diagnosed with leukemia that was attributed to the 340 x-rays that were done on her to try and find out what might be wrong with her by the 22 physicians who weren't able to diagnose her condition. In 1977, she died from leukemia. She got a $50,000 settlement from the supplement manufacturer, and the FDA said, well, you know, it's not within our purview. But it turns out that the supplement was made from the bones of carriage horses in London who had spent their entire lives breathing leaded gasoline fumes from the cars that they were competing with on the streets. So this was a situation where this woman was prescribed a calcium supplement, and it killed her because of the lead contamination. So I think that might be a good stopping point. I know I've got more slides, but it's diminishing. So before I'm talking to just myself, I think I'll stop there. And thank you for your attention.